Hey Hattiesburg, it's Toby Barker, and thank you for joining us for this Thursday briefing. Hope everyone got through the weather okay this morning, and we just got off our first community stakeholder group call, planning the recovery from COVID-19 in our community. We got off that call. I'll talk about that in just a second. But first, we're going to talk about some testing numbers. We're going to talk about kind of what the path forward looks like. We'll talk about goals for our community group, and then we'll talk about the sub-working groups and just of course, our regular active courage. Today's numbers, again, these are all system-wide. Forest General serves 19 counties. Merit Health Wesley serves 18 counties. Cimarron Hattiesburg Clinic serves several counties as well. So when you see these are not necessarily indicative of Forest and Lamar counties, but rather the entire region of the Pine Belt and some of the South Mississippi. So as of today, we've tested 4,342 between our four healthcare organizations. 491 of those have come back positive. 3,616 have come back negative, and we have 235 tests that are pending. Of course, this continues a positive trend for us. We're continuing to see that pending test kind of fall between right under 200 to 250. This means we're getting very efficient results back. It means that we're not burning through a lot of personal protective equipment in the inpatient setting. We're finding out if people have COVID or they don't, and then we can get them the appropriate treatment without putting our healthcare staff at risk. So our overall goals and what we've been doing is protecting vulnerable populations. Those are people over the age of 60, and then of course preventing overrun of our healthcare system by slowing the spread. So if and when you need care in Forest and Lamar counties, you can get them at one of our two great hospitals, and there will be the personnel and equipment to take care of you. Right now, in hospital confirmed COVID cases, again, this is both Merit and Forest General, we have 37. That's down by one from yesterday. Over the average over the last 14 days, and I'll tell you why that 14-day period is important going forward, 30.43 have been in the hospital. So while this is an increase over the average of the last 14 days, we're actually down from a couple of days ago, which is good. We have no patients right now under investigation. This is the trend line. As you can see, a couple of days ago we got up to 41, but now we're kind of settling back into that 36, 37, 38 mark. We also look at ICU admissions. These are the most acute patients that require very specialized equipment and personnel. We have 10 patients in the entire Hattiesburg health system between Merit and Forest General. So 10. That's actually down by 3. And the average over the last 14 days is almost 13. So the fact that we're at 10 right now is a very positive development, that we are able to manage most of these COVID-positive patients in the outpatient setting, or keeping them from getting sick to where they need to go into the ICU and be intubated. Right now we have no patients that are under investigation in the ICU. Today's totals. Forest County had an increase of 6 cases. We're up to 164. Lamar County stayed flat at 79, so our entire metro area is at 243 right now. These are the trend lines since this first began. Obviously, the increases are getting smaller, which is a positive development. Of course, we look at the 5-day average. Again, this is something that Jody Waits from Lamar County brought to us from Johns Hopkins University. But what the 5-day average does is it takes the day of and the 2 days before and the 2 days after, and what you do is it kind of accounts for any kind of aberrations or outliers. It gives you what a more consistent trend on where you're headed. And so Lamar County is the orange line and Forest County is the blue line. So a couple of days ago, the 5-day average of Lamar County exceeded that of Forest County, but since then Forest County has picked back up the last couple of days. And but what's positive is, a week ago we were getting days where we had 20 new cases. Now we're getting between 4 and 5 in each county going forward, and that's a positive development, that we're staying under those double digits for our metro area, and so we hope that trend continues. Some updated demographic information for who's becoming positive for COVID. In Forest County, 48% are African American, 40% are white, 10% are other, and 2% we're lacking data on. Lamar County's even 50-50 split, 44-44 white to black. Then we have 8% other, and then some others that we don't have data for. And so as the conversation this week around the country and in our state and in Mississippi is, how do we move forward? What is the path forward? The federal government's having their conversations. Governor Reeves is having those conversations at the state level. But how will we as a community, the Hattiesburg community, move forward? And so what we have done, and last night I announced a community working group made up of leaders from healthcare and private sector, from restaurants and tourism, from government, all with the idea of how do we move forward. Because I've talked to you about our two goals that we had up to this point. It's protecting our vulnerable populations, preventing overrun of our healthcare system. But there's some broader goals now. We want this working group, these new voices at the table, to help us chart the path forward, to prioritize public health while giving the economy space to operate creatively. We want to keep an eye on the short term and the long term. We want to make sure that we're continuing to empower good decisions both individually and collectively. Right now, most importantly, in the age of social media, we want to make sure that accurate information is getting out there, that we are positively influencing morale, and we're going to normalize the new normal. And then finally, just how can we reimagine Hattiesburg? How can we come out of this stronger than we were before and do things differently where we are advancing our economy but also taking care of public health? So again, this is our working group right now, and there's some questions that we've received since then. Such as where is education and long-term care facilities and grocery stores. And the truth is we began meeting with those groups several weeks ago. Of course, I'm on a weekly call with a stakeholder group that includes all of our public schools and universities and community colleges and government officials and healthcare providers. We have a separate group. We meet with nursing homes to kind of see how they're doing with their equipment and how they're doing with any kind of outbreaks that are going on there. And of course, we've met with our grocery stores on different things we've implemented in terms of keeping crowd sizes small. And so these groups already have set forums that we meet with them in. And so really this new working group represents a new set of voices that are collaborating and coming together to try and plan the path forward from here on out. And so today we had that first conversation, and we heard from our healthcare providers that on what treatments they've been trying, what is the real possibilities of having a vaccine or a treatment over the next 12 to 18 months. And again, that's a long-term timeline. They're also talking about a lot of the elective procedures and other care that were frozen by the governor's shelter-in-place order and by some decisions made by the Department of Health. And so how do they maybe kickstart those where we can get our healthcare economy going again and people can access the services they need? We also heard from our small business sector, and hearing from Todd Jackson from the ADP talking about just, a lot of businesses want to get started, but they want to make sure we're doing so safely. And so we will continue fostering and hearing those voices. We talked to a couple of our churches. Father Tommy and Reverend Wilson from Ebenezer talked about what it's been like going to a live stream type setup. And Reverend Wilson specifically mentioned that he knows his members are starting to experience social isolation and the need to be joined in community. So we'll be talking about how we can bridge that gap for them. In fact, we had another voice from Pine Belt Mental Health talking about just seeing increased levels of anxiety. So what is our community strategy going forward on that? We also heard from our tourism industry. Marlo Dorsey talked about how hotel revenues are off 60 and 70%. In fact, 67% of all new unemployment claims around the country come from hospitality industry, which includes restaurants and hotels. We heard from Chris Ortego from Cotton Blues, who talked about wanting to take care of his employees and making sure that there are certain trade-offs to keep the public safe if and when we move forward with opening things up. We also heard from government officials, David Hogan from Forest County, Jody Witch from Lamar County. We talked about tough decisions that the city of Hattiesburg has ahead. And so really, for a first meeting, it was very collaborative and a lot of great information was shared. We look forward to talking to you further about those things that are going on. We also heard from our two members from the Hattiesburg community that are on the governor's task force. Jonathan Jones from Jones Company, Robert St. John from New South Restaurant Group shared a lot of insight and kind of some things that are being talked about at the state level and what that means for the city of Hattiesburg. So going forward, we want to make sure that we are staying in touch with you, that we're keeping the lines of communication open as people are having ideas on things we might implement as we start to try and chart a path forward. Of course, acts of courage, we've been wanting to mention this, but so many people have been great about coming to feed our police department or fire department or our sanitation workers this week, or even the mayor's office from time to time. And so to all these folks listed here, thank you for, I know times are not easy right now for you, but the fact that you think of your first responders and your public servants and the people that have truly been on the front lines and essential means a lot to us. We thank you for that. And to those of you who are listening to this briefing, we thank you for stopping by, but just remember some past going forward. Please wash your hands. Please take care of yourself physically and mentally. Please wear a mask if you go out in public. That is going to be a long-term solution for us keeping infection rates low. Do only what is essential and stay home if you can. But thank you for joining us today. We look forward to talking to you soon.